Well, nice to meet you, sir. How can I help you?
Thank you. It's nice to meet you too. I just wanted to let you know that I'm a general dentist. I had my own practice for a long time. I sold it to a younger dentist because I was interested in getting out of general dentistry and getting into sleep apnea treatment, which I did for about 4 years exclusively. I was the first practice in St. Louis to only do sleep apnea dental treatment.
Impressive.
And after I did that for
Okay.
about 4 years, I had the opportunity to get into implant training and full arch dental treatments. So I got some training in implants and did that for about 4 years. And now I'm sort of looking at what can I do to help go back into the sleep area and to find out a little bit about treating the root causes of sleep
Perfect.
problems and airway problems in a little bit more advanced way, instead of just advancing the jaw and advancing the tongue, to find out how we can address some of the airway issues.
Thank you, doctor. So let me share with you a brief presentation that I have, and hopefully that'll answer a lot of your questions. And then we can do a Q&A afterwards. Is that okay?
That would be fine. That would be very good.
All right. All right. So let's see if you can see the screen okay.
I can see it. Yes, I can.
Okay, good. So there's been a paradigm shift. So I like to say that in the dental world, the earth is no longer flat.
That's good.
Okay, so if this statement by Thomas Edison excites you, this is for you, okay?
Okay.
The old paradigm is, oh, you grind your teeth, we'll give you a night guard. Well, the new paradigm is that teeth grinding that necessitates the night guard is rooted in airway obstruction, and that in turn is rooted in underdevelopment of the jaws.
Okay.
All right. So we are empowered to do this by no less than, guess what? U.S. Surgeon General, the highest medical officer in the land. All right. So when we become doctor of the mouth, okay, when we recognize this thing that I call impaired mouth syndrome, we'll get to help many medical and solve nearly all the dental problems.
Okay. Right?
So my job is to help widen your dentist viewfinder from seeing just teeth to seeing the whole person, from head to feet and from birth to now. All right. I've written just a few books because they're fun. All my cases, as you will see, have teaching points to share.
Okay.
And as a result, I've developed a bone building diet to cope with the Start Thriving appliance, and I'm a director of AMD Training. All right.
Okay.
So here's what I teach. So Newton famously, discovered gravity that gets us to the moon. All right.
Yes.
Because he said, well, how come the apple doesn't fall sideways and it falls downward? Right. So I've had a few apple moments that I call ahas. Okay. And hopefully there will be your discoveries as well. Okay. Okay. So one of the discoveries, this is my first book is called 6 Foot Tiger, 3 Foot Cage. All right.
Okay.
This is how airway obstructions happens when the jaws are too small for the tongue. Make sense?
Okay.
All right. So clinically, this is what it looks like. The patient have all these problems, and the dentist just do teeth. And so the patient goes to different doctors, medical, chiro, massage therapist, physical therapist, and guess what? She didn't get any better for 40 years. Poor thing, right? So obviously something is not working, okay? So what are her symptoms? pain, TMJ, pain, SI joint, pain, wake up tired, and jaw crooked. And she's prone to urinary tract infections. This is what her mouth looks like. Guess what? This is what her airway looks like. Okay, she's got a 28% airway. All right.
I see that.
This is how an AMD look at the patient. Okay, what are the oral contributions? So dentists are trained to be two doctors. Okay, but this old paradigm, as you well know, has limitations. What are they? Well, some of them, you run into many head scratcher cases, right? Why do you get peri-implantitis? Why do natural teeth fail? Why do root canal fail? Okay. Why do some patients have nice straight teeth and they feel miserable? If I tell you to double your practice, you have to work twice as hard. You're gonna have twice the pain, fatigue, and eventually that'll lead to burnout. Okay, so there are limitations to the old paradigm, not to mention career fulfillment. I don't know how much you enjoy closing that last micron on the margin.
I don't.
I always thought, no, but it's really not that impressive, right? The patient
Correct.
doesn't care. Yeah. Okay. So there are much more fulfilling ways to be a dentist. That is to become what I call an airway mouth doctor. Okay. You can empower systemic health that way. All right. So paradigm problem number one is that twice the production means twice the pain and fatigue for the producer.
Sure.
Right?
Yes.
I'm telling you, there's an easier way and painless way. Okay. So you are not only what you eat, you're also how you sleep and align.
Sleep and what?
So you are also how you sleep and align. You're not just what you eat.
Right.
Right? Okay. So I thought about the role of the mouth in whole body health. And it turns out that the mouth is actually a fun part of the human anatomy to be a doctor in.
Okay.
Okay. This is a lot of fun. So, you know, we all are born with the ability to suckle. All right. And after we are fed, we fall asleep as newborns. Right.
Yes.
And you repeat a cycle, that's how we grow. Okay. So this relationship between the mouth and the whole body stays the same throughout life. So the mouth is either a root of growth and a source of wellness, or it's a source of illness and pain. Right? Depending on what? Depending on what I said here. You are what you eat and how you sleep and align. We're going to address the sleep and align part as a mouth doctor. Okay?
Okay.
So when the mouth fails to thrive during the developmental years, you're going to end up with this thing that I call impaired mouth syndrome. And I define impaired mouth syndrome as many medical, dental, and mood symptoms from deficient jaws and obstructed airway.
Okay.
All right. And all these conditions that you see on these bullets here have been reported by my patients. I didn't make this up. The patients reported that they got better as a result of having this discovered, diagnosed, and treated. So when you fix this, a lot of good happens. When you don't fix this, these problems persist. And that includes implant failures and natural teeth failure. Okay? By the way, this is being recorded, so you don't have to take notes. You can have a copy of this.
Thank you.
Yeah, sure. Okay,
I'm just writing some of the abbreviations.
Yeah, no problem. So, you know, teeth grinding was how I got into this. I mean, teeth grinding just didn't make sense to me when I got to college as an engineer, right? Why would the body destroy the hardest tissue it has? I mean, that's a head scratcher.
Yes.
Right? Nothing that the professor told me in dental school or after dental school, for that matter, made any sense to me. All right.
Okay.
And all we did was fix this thing and fix the aftermath. And all the while I'm saying, what's the root cause, right? This thing nagged at me for a whole career, okay?
Mm-hmm.
And it turns out that when you look further beyond teeth, that is, you start to think like a mouth doctor, you'll find out that many of your patients who grind their teeth also have these problems. They just don't know. They just don't know that it's connected. And that's what I teach, how to connect these dots, okay? So bruxers have a multitude of other symptoms that goes with it. It's just that when you only see teeth, you don't know that they're connected to the other parts, like these here, okay? So here's a case that was very early on in my career. It's about 10 years old now. She showed up at age 17 and said, I ground through my night guard, can you give me another one? And I looked at her and I said, wow, would you want more of the same? Or do you want to avoid insanity? That is expecting a different outcome from the same thing. She said, there is a different solution? I said, sure. If we understand what causes this, and we'll put you on myofunctional therapy, and we treat the root cause of this, you can have a better face. Really, let's go for it. At that time, I met Dr. G. Dave Singh, who invented this thing called a DNA appliance. And
It's
he
called a
was
what
the first to
appliance?
show DNA appliance.
DNA.
Yeah, DNA appliance.
Okay.
At that time, he was the first to show that you can treat sleep apnea with a maxillary appliance. And in this case, he gained 58% over roughly 2 years' time. And
Wow.
the reason for that is that the periodontal ligaments have stem cells that can make bone. That's what happens when we take out teeth. The socket fills up with bone. Where does that bone come from? It's from the PDL. There are stem cells there, okay? Now we can use that stem cells, put them to work by using this appliance. And so we took her from here to here, and her face changed.
Okay. Yeah. Wow. Yeah, it did change.
Look at her. Look at her. Okay, this is called epigenetic redevelopment. Okay, this is why the earth is now round for us airway mouth doctors. It's no longer flat. We're no longer in the dental world. We are in this new era of epigenetic redevelopment. This is a huge deal. And here's the evidence.
I see.
You see the airway?
Yes.
We tripled her airway volume, and we more than doubled her minimal cross-sectional area where the obstruction leads to collapse of the airway to cause apnea. Okay, this case was published in a peer-reviewed journal. And by the way, the opening line says, evidence suggests that sleep bruxism is centrally regulated. That means it's not in the mouth, it's in the brain. And that the highest risk factor associated with sleep bruxism, which is teeth grinding, is OSA. All right. So sleep bruxism is OSA. OSA is sleep bruxism. They're connected by the airway. Okay. So when you widen the airway, you stop bruxing. All right. That's borne out by this study done in Israel. It says complete eradication of the teeth grinding was seen during CPAP titration, meaning that when they force enough air past this choke zone, teeth grinding stops. Well, we have a better way. We can expand the jaws so that the airway increases, because the tongue now doesn't have to be shoved down the throat.
Mm-hmm.
All right. Okay. So there's a huge lesson in this transformation from here to here, because this can be done with almost everybody as long as they have sound natural teeth. Okay, so you can give them night guard or you can give them CPAP, and you're not going to see this. You're going to see this only with this method called epigenetic redevelopment. So CDC defines epigenetics as the study of how behaviors and environment affect gene expression. So translated, that means this is partial gene expression, this is full gene expression. What happened here? Well, we unblocked her, okay?
We what?
We unblocked her.
Unblocked, okay.
We
I'm sorry.
restarted her partial gene expression, if you will.
I see.
Okay? All right, so this is important, right? Because if you can control bruxing, guess what? You can control implant failure,
Yes.
right? When tooth fails, you can offer them implant. But what happens when implant fails? What are you going to do?
It's a good
Well, the
question.
better thing is to stop them from having to get there, right?
Yes.
Because this is where it's different, okay? The new paradigm is that bruxing is an opportunity to assess airway. Do this and fix this before you do implants. This is my advice, okay?
Sure.
This patient is a very compliant nurse. They're trained like hygienists to follow doctor's orders in the medical world.
Yeah.
Well, she listened to every recommendation her dentist said. And guess what? This bridge failed 3 times. It broke and came off. Okay? And here's the reason why. Okay? That's her airway.
Wow.
Okay? White is 400 square millimeters and red and black is 100. You can hardly see any red here. Okay, so she is struggling for air. That's why she bruxes. And so the implant failure rate in bruxers is 3.3 times higher. This is one surgeon doing 10,400 implants, okay? This is an astounding number of implants. I mean, I don't know what my wrist will feel like doing 10,000 cases. But what they found was that bruxers have 13% failure rate and non-bruxers have 4.6 failure rate. That means same surgeon, you're not a bruxer, I'm a bruxer, my implant failure rate will be 3 times higher. All right. I don't know about you. I don't want to buy a car that has got 3 times the likelihood of being a lemon.
Exactly.
So my recommendation is to do ABC before D. That means alignment, breathing, circulation before dentistry, doctor. Don't do implants until you got this under control.
Okay.
Okay. How about TMJ? Did you feel well trained out of dental school on
Absolutely
TMJ?
not.
Nobody. Okay. And yet we know that TMJ is so well innovated that if you hit the right spot, you can crumple the strongest patient in the strongest man in the arena down to the canvas. All right.
Wow.
So you can knock out somebody with this. Okay. So here's a dentist who said, I am living impaired mouth syndrome now. Okay. She's got severe chronic TMJ. She's done everything, including chiro, acupuncture, massage, and even trigger point injections. She has facial asymmetry, fatigue, typical posture of a dentist, restricted airway, and teeth grinding. All right.
Okay.
I mean, dentists are worse than their patients because we had to bend over a patient to make a living. All right.
Yes.
So we did our homework, gave her my appliance, and my appliance is different from Dr. Singh's DNA appliance. That's not the important detail. The important detail is that I'm epigenetic, meaning that I also give the patient a bone building diet. Okay, it's got bone broth, it's got green smoothie, the best of plant world, and the best of the animal kingdom. Why? Because if you want to grow the maxilla, you need to give the body some ingredient and grow it with. You can't eat standard American junk diet and expect the body to thrive. Never mind grow.
Understood.
Okay?
Yes.
All right. So epigenetically, you can grow anybody's face at any age. Okay? So this is the dentist who suffer from TMJ pain. Before we started, and this is month 3 rather, and here's month 12. The face changes for the better.
I see that.
Okay? Yeah. Now, this is what I mean by a impaired mouth syndrome. Okay? A syndrome is a collection of symptoms and signs that together represent a disease process. These are her presenting complaints. Okay? We use a scale of 0 to 10. 10 being you can't function. 0 is like when you're a teenager, nothing touches you.
Right.
So she came in with jaw pain, 8 out of 10. Sleep quality, 8. Right hip clicking, 6. Mouth breathing, 8. Headache, 6. Back pain, 4. Daytime sleepiness, 8. Brain fog, 5. Poor digestion, 4. Total, 57. Well, guess what? Everything decreased over 10 weeks' time. 8 to 2, 8 to 1, 6 to 0, 8 to 2, 6 to 1, 4 to 1. So the total improvement went from 57 to 11. That come to 81% improvement. Okay, so all we did was what? Fix the mouth structure. I grew the jaw epigenetically and everything fell away.
That's amazing.
This is
Just
only
because
10
you
weeks
open
in.
the airway.
Yeah, right, exactly. All right. So this is only 10 weeks in. Her TMJ pain is gone. Her jaw pain went from 8 to 2. Okay. So what we can say is that impaired mouth gives rise to a bunch of symptoms across specialties. And 2, okay, if you treat impaired mouth, you help all the symptoms. It's like, you know, when you raise the water level in the pond, it floats all the boats.
Right.
Right? Okay.
Right.
So anyone who's got neck, shoulder, and back pain, mostly dentists, more than anyone else, will end up with they end up here because when they're kids, nobody diagnosed them. We desperately need doctors who can catch this as early on as possible. Wouldn't that make sense?
Sure.
Because if you do, you wouldn't create some of the catastrophes we do in dentistry. All right. So is it too many teeth or too little jaw? I mean, you can totally screw up somebody when you get this wrong. Okay.
Mm-hmm.
This set of jaws create this airway. All right. So if you take out teeth and close the space, what does that do to this airway?
Closes it even more.
Yeah. So we have the research to prove this. Okay. Pediatric OSA in non-obese children is a disorder of oral facial growth. Case closed. Our job is to grow the jaws, and we know how now. All right, so this patient reached out to me from the other side of the world, Perth, Australia.
Wow.
Bicuspid extraction, okay? She's got beautiful straight white teeth according to conventional cosmetic dentistry standards, right?
Yes.
And parents say, what do you have to complain about? You got beautiful teeth. But the patient said, I feel miserable. Is that a success? Well, you shouldn't feel miserable because you have straight white teeth. No, she wanted to kill herself because nobody recognized that her airway was made smaller, like you said. when teeth were taken out.
Mm.
All right. They didn't tell her to also correspondingly shrink this tongue when they close the space. So now she's got a 6-foot tiger in a 2-foot cage.
Mm-hmm.
Right? And she
Yes.
wanted to kill herself because the pain was so bad. Okay. Now here's what happened. Okay. 10 months. The face completely changed. And her jaw pain is gone because she's got normal range of motion. And we documented this with the same thing, scale of 0 to 10. Okay. She got 7 symptoms. She came in at 63. That means she averages 9 on everything. Now her jaw pain went from 10 to 0 in 28 weeks for a gain of 10. Okay. Her sleep disturbance went to 4. Her snoring went from 10 to 3. Her daytime sleepiness was cut in half. Her poor digestion was cut 70%. Okay. So the total gain was 67% in 28 weeks. There's not one pill, not one operation, not one dental reconstruction, or whatever it is that you treat this syndrome that can do all of this.
Sure.
Yeah? Okay. So what we can conclude is that if we change the behavior and the environment, we can reverse impaired mouth syndrome. This is the new paradigm, okay? And we are actually empowered to do this by no less than U.S. Surgeon General. Stop being a tooth doctor, start becoming a mouth doctor, okay? So here's the maxilla. And look, this is the ideal human arch form. This patient will have brilliant mind. This patient will have perfect health, high energy, and totally attractive face. Okay, I'll show you her case separately later on. And here's what we need to look for. Okay, asymmetry in the ears, nose, eyes, lips apart, tiny nostrils, and asymmetrical mandible outline when you look from the submental vertex view. And if you know how to put this all together, you can grow kids from here to here without braces. We grew this face without using braces. You know what AI stands for, right? It stands
No,
for
tell me,
artificial
please.
intelligence. Okay.
AI is
Well, I have another definition of AI.
okay.
Oh, artificially imposed.
Okay.
That's what an orthodontic arch wire is.
Okay.
We did not use AI on this. We used the patient's own genes.
Okay.
No imposition, nothing artificial.
Okay.
What I did was I brought out the best version of the double helix DNA encoding
Okay.
to reality. Okay. So what she had was partial development. I brought it into full development. What is full development? Room enough for all the teeth to line up straight in the jaws naturally.
Okay.
That's full genetic potential in the face and in the mouth. So
Okay.
that's what I wrote. That's what I wrote in this book, Your Child's Best Face. That was just released in November. And this one, I just released it on January 5th this year. Relaunch of Vitality. Same principle. It just, this is on children who are growing, and this is on adults who have stopped growing. So when you know epigenetic redevelopment, you can not only grow your children's best face, you can relaunch vitality in the adults who have chronic pain and fatigue. So I define what a best face is. So we can do better, right? We can grow this thing this child from beginning. This is my granddaughter. Okay.
Okay.
We're growing her from the beginning with fresh home cooking and License to Thrive guidance.
Okay.
Everything I wrote about in that book, my son, who's a professional chef, turns into meals that she eats. So every meal she has had in her life, she's going on 2.5 years old now, is done with epigenetic nurture, fresh home cooking, according to Dr. Liao, through Chef Franklin.
Wow.
And okay, so no junk food ever in this child, okay?
Very nice.
Scoliosis. Scoliosis. Even when I was a holistic biological dentist, I wouldn't touch scoliosis, right? Well, I do now because scoliosis has an oral contribution that without us involved, they don't get better. Okay, so this is 12 months of jaw growth and postural restoration physical therapy. And here's what happened to this patient. She came in with her midline saw. We put the appliance in, line up her midline. Look what happened to her feet. Medial pronation to no pronation. All right, so the physical therapist had heard me speak before, and she contacted me, and I said, I will do my part so that you can do your part. That's what it takes to succeed. Okay, so this is what the same lady looks like. I noticed that when she came in, she wore this t-shirt. So I asked her, can you wear the same t-shirt at 12 months checkup? Look at that, she's straightened.
Yeah.
Okay. So this work is a lot of fun because I don't bend over the patient. If you look carefully, you can barely see. Huh?
I missed that last part. Because you what? It's a lot of fun.
I don't bend over. I do not bend over the patient for a living.
Ah, I see. I see. Yes.
Okay. This is
Yes.
low overhead and very high joy.
Yes.
There's no shots, no drill, no pain prescription, no antibiotics. Okay. They just wear this thing to sleep. That's it.
Okay.
Okay. So if you change the environment, if you change the behavior, you can reverse impaired mouth syndrome regardless of age. So just quickly, a few examples. This is a pilot. We gave him this appliance, and he's clear to fly because his AHI, according to his CPAP machine, is 2.3 for the whole month. Okay. And when AHI is less than 5, they don't have sleep apnea and they're clear to fly.
Wow.
Yeah. Okay. And gradually she can wean off CPAP by expanding the jaws. Okay. What you need to understand is that when these people sleep with this kind of choked airway, they confront death every night. Okay. And they end up with pain because they have sympathetic dominance. And when the sympathetic is upregulated, the pain doesn't stop. And so here is a case where the patient had beautiful crown work done. And it created this or contributed this SI joint pain. It was so bad that she could not sleep longer than 2 hours. Well, here's what she sent me about 2 months later. She says, 0 pain last night. So grateful. It says hip hip hooray. And this is emotion. This is great satisfaction, right? So this patient says it's so wonderful to have more energy, and here's why. We took her from -5 to -1, -2 to +3. So that means the maxilla is wider.
Right.
We did not create gaps here. We didn't open up any space. but we did uncrowd the lower front teeth. Okay, we took her from -1 to +5 and -4 to +2. This is all based on the same 4 upper incisors measurements.
Okay.
Okay. So think about, how many old problems you have in terms of crowded lower anteriors and teeth grinding. Never mind TMJ and bicuspid extractions. Okay. Everybody under the sun has got this. I figure more than 90% of the US population suffer from this. The only ones who don't have it are either the native people or the new arrivals. If you grow up here, you have impaired mouth syndrome because of food supply, okay? All right, so coming to the end here, last case. 64% of the men who got referred for sleep tests already have erectile dysfunction. All right, so ED, according to European Urology Journal, says that this is the tip of the iceberg of systemic vascular disorder. Okay, that means it's just the tip of the iceberg. And the quote from this paper says, most cases of ED recognize a vascular etiology. What I have to add to that is that this vascular etiology has a sizable oral contribution to the airway obstruction. Okay, so this is a case of this patient who came back, said, hey, I got morning erection back. And he said, I wonder if they're not advertising the wrong things during football games on TV.
Sure.
All right. And here's the evidence. Okay. We took his airway from 123 to 225.9. Should have been 226 here. Okay. So we literally doubled his airway in the minimal cross-sectional area. Okay. This is what solves the ED problem. All right. So when you can solve this problem for the penile artery, you can solve it to the pulpal artery. You can solve it to the solve it for the coronary artery and the cerebral artery. Does that make sense? Sure. Yeah. So here is a paper written by someone named Paul Check. It's called Totem Pole Hierarchy of Survival Reflexes. In other words, this chiropractic neurologist set up to ask the question, what are the most important reflexes to survive? And the answer is breathing first and eating second. Vision third, the fourth is hearing. Well, they're all, out of this whole 8 of them, 5 of them relate directly to the mouth. That's how important the airway mouth doctor is. Okay. So if you know how to do this, you can offer the ultimate proactive care. Okay. Because heart disease kills more than 1,900 Americans every day. It's not even news anymore. And we can do that by addressing the impaired mouth structure that relates to these conditions, and by coaching them on how to eat that relates to these conditions, and then you can head them off this killer iceberg that can sink their ship. So this is what opportunity lies ahead of you, doctor.
What's case acceptance when you see a patient and they need this treatment? Do they accept, or are they skeptical?
No. There'll be about, my case acceptance runs somewhere between 2/3 and 3/4. Okay. And the ones who say no, they often come back, sometime 6, 12 months later or 2 years later and say, I got my money together. Because usually that's the only reason that stopped them. I mean, look, this is my own case, okay? Who doesn't want this? This is my own case. Pre-treatment, 13.1 cc. Post-treatment, 28.2 cc. This, I would submit to you, is the only meaningful health insurance in retirement.
Healthy what?
Health insurance.
Yes.
That's the only, because with this, you can renew yourself. Okay. So nobody would say, I'm happy to live with this. The only way they put up with this is because they're looking to improve their financial situation so they can afford the treatment. So more information is in here. And I hope this brings me to the end of my presentation.